And the big difference is really in fibromyalgia. So when I'm treating someone for their causes, it can take time for them to get resolution to their symptoms. And someone with fibromyalgia just can't deal with that. They're in so much pain, they can't function, they can't do things. So I usually give them something to help with their pain. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Today, I'm going to talk about the connection between fibromyalgia and chronic fatigue syndrome. What is chronic fatigue and what is fibromyalgia? So they're very similar, but they are different. So chronic fatigue is that you have been dealing with low energy for at least 6 weeks or longer. This is more than that you just have this basic lull of energy. It's like it's very difficult to function. You can't concentrate very well. You can't perform daily tasks very well. You could do them, but you got to push yourself really hard to be able to do them. And this has been going on for a while. Fibromyalgia is different because it is more related to pain. It is that you have pain throughout your entire body. And it usually isn't just like arthritis type of pain. It's more of a muscle pain. So many times patients can't really decipher between the two. They do tell me they have joint pains when they do have fibromyalgia, but really the clear diagnosis of it is that they have pain in their muscles. And you press certain trigger points throughout the body to make a diagnosis of fibromyalgia. Now, most patients, in my experience, at least like 95%, have a combination of the two, especially someone with fibromyalgia. Fibromyalgia almost always comes along with chronic fatigue. Now, someone that has chronic fatigue, I definitely see that they don't have pain, but many times they do. So many times doctors and many times patients will use those terms interchangeably, even though they are quite a bit different because one relates to pain, one relates to having low energy. Why do a lot of people diagnose these together? Many people they're diagnosed with chronic fatigue and fibromyalgia. So the big reason is because their causes are very similar. The deep down cause of chronic fatigue syndrome and fibromyalgia is mitochondria disruption or damage. So a lot of people that have mitochondrial damage will be tired, and many times they will have chronic pain throughout their body also. So many times people are diagnosed with both of these because the cause is the same. Food sensitivities, or a gut that doesn't absorb nutrients very well, or you have toxic exposure to heavy metals or other toxins that are in our environment, or mold exposure like with mycotoxins. These are all things that damage the mitochondria, and I see these diagnoses and the causes be very similar in both groups. So this is the big reason why they are linked together. Are the treatments for fibromyalgia and chronic fatigue the same, or are they different? So yes, they are the same in many instances, but there are certain nuances that are different. And the big difference is really in fibromyalgia. So when I'm treating someone for their causes, it can take time for them to get resolution to their symptoms. And someone with fibromyalgia just can't deal with that. They're in so much pain, they can't function, they can't do things. So I usually give them something to help with their pain. So that could be, so there's some natural things like turmeric, boswellia, cordyceps, and many other herbs that we could prescribe to help. So I do prescribe those when I'm treating fibromyalgia. But then everything else that we do for chronic fatigue, many times I'm doing for my fibromyalgia. But every individual patient is treated differently. There's certain causes that I'm always going to look at, but obviously those causes aren't going to be the same in each patient. So every patient with chronic fatigue and fibromyalgia that comes to my office will receive a different treatment protocol. It's not like I just have, we do this, then we do this, we do this. Like in conventional medicine, you come into the doctor, the allopathic physician, they're going to have a certain protocol that they do every time the same for each patient because they're just treating the symptoms of the patient. How I approach it is a lot different. I'm going to be going after the true causes of it, and it's always going to be a different treatment protocol. how long does it take for a patient to start feeling better when I'm treating them and treating their causes? I tell them, hey, for you to start feeling really good, it's going to take about 2 months. It could be longer, it could be shorter. I do have a lot of patients with chronic fatigue and fibromyalgia. They do start feeling better within a week or two. They're not all the way better, but they're feeling a lot better. And I have others that takes 3 or 4 months for them to even notice anything at all. So they need to be really patient. I need to counsel them and really tell them what's happening, because we're treating the causes, treating the bug and boosting the immune system. When we boost the immune system, this makes more inflammation and can make things a little bit worse for a little bit. But really, for them to get better, we got to kill off these bugs. And then when we get these all put in a dormant state, their symptoms go away. So it's variable, but I would say probably around 2 to 4 months, people will feel really good. What's the difference between a conventional allopathic doctor's treatment approach and my more naturopathic integrative approach? The big difference is, like I was talking about, is I'm going to identify the root cause. The allopathic medical doctor, what they are going to do is they're going to treat the symptoms of the disease. Okay, so let's talk about fibromyalgia, for example. Many times what they prescribe, the most common drug they prescribe is gabapentin, and they prescribe many antidepressants which have a anti-pain component, or just subdue your emotions so you don't feel pain as well. That's the typical treatment for that. So it's not really going after what is causing the pain, right? It's just covering it up with the medication, making you not sense it as much. So what I'm going to do is I'm going to order a lot of laboratory work. I'm going to do thorough questioning, talk about all your review of systems of what's going on in your body to really identify the cause, which are multiple. We talked about a few of these. It could be heavy metals, toxic exposures, mold, chronic infections, food sensitivities, gut issues, poor nutrient absorption, on and on and on, right? A lot of different causes. And that's what I am. I'm this little detective trying to find out what is that cause. And many times patients with fibromyalgia and chronic fatigue, they have multiple causes going on. So we need to treat all those, eliminate those causes, treat the damage that has happened to the body from these causes, and then the symptoms will be cured. And then you don't have to depend upon something your entire life, like through a painkiller that has a lot of side effects or whatever. So that's really the big difference between the two approaches. So if anyone wants to identify the real root cause of the chronic fatigue or fibromyalgia or any other chronic disease, yeah, you can set up an appointment with us by visiting our website, www.integrativemedica.com. Call our phone number there with my receptionist, and you could do in-person or virtual visits. If you want to learn more about the solutions for fibromyalgia and chronic fatigue, click my videos to the right. I'm Dr. Jake, and I'll see you there.